For joining and a very good morning, afternoon, evening to all. Welcome to today's webinar on the crucial topic of lead poisoning and the importance it has, the devastating impact it has on young children. I'm Neelima Chopra. I'm the Program and Partnership Specialist with ARNEC, and I'll be moderating today's session. As we know, lead poisoning is a very significant concern, especially in the Asia Pacific region for young children. It has a lot of detrimental impact on their development and their health, and raises a lot of health issues and concerns. So in today's discussion, we'll explore the challenges and the opportunities involving in tackling lead poisoning, especially in the context of Asia Pacific region. And before we kick off the webinar, a few reminders. Neha, we can. A few reminders. The webinar is being recorded, and the recordings, along with the slides, the presentations by the panelists, will be available on our ARNEC website afterwards. Please do check them out. Also, we encourage active participation from our participants. Type in your questions and answers in the Q&A features. Type in your questions, your inputs and feedback in the Q&A feature. Also, we would request feedback on the webinar towards the end of the session. We'll request for you to complete a quick survey. Do fill in that survey before leaving the webinar. Next slide, please. We'll have an open forum where we'll request you to speak and share your inputs and feedback and ask any questions. Raise your hand, and I will invite you to speak. So with this, let's dive into the webinar. The main objectives, a little reminder of the objectives of our webinar, is to understand what are the health impacts of lead poisoning on young children. Also to equip stakeholders to mitigate and to tackle this crisis. And this is also an opportunity. It provides a platform for co-learning, for sharing experiences from the countries that are working towards addressing this issue. I'm very happy to introduce our distinguished speakers and panelists. We have a range of speakers who are involved in resolving lead poisoning in this region. So Evelyn Santiago, she is the Executive Director of Asia Pacific Regional Network for Early Childhood, and she has over 25 years of experience leading, and has had leading roles at Child Fund International and has worked with GIZ and the Philippine government. We also have Lynn Tang, who is the Director of Programs for Environment, Climate, and Urban Health at Vital Strategies. This is an international public health organization. And with 20 years of experience, Lynn's expertise is on projects on air pollution, lead poisoning, non-communicable diseases, and environment health data. We also have Hassam Khattak, who works as the LEAPS program manager in Pakistan. So LEAP is Lead Exposure Elimination Project, and he is spearheading the paints, spices, and cosmetics program plans. And he has a background in management consultancy and an MSc in biochemistry. We also have Larah Ortega-Ibañez. She's the country director of Pure Earth Philippines, and leading the programs to address toxic exposures, protect health, and restore environments. She has some 17 years of experience in the development sector, and recently she has been pioneering efforts to institutionalize lead poisoning detection and interventions in the Philippines. We have Kinley Dorjee from Bhutan. He's a public health researcher with the HMIS and Research Unit under Bhutan's Ministry of Health. And since 2017, he has been involved in various health research projects, data management, and policy analysis. And he has significantly contributed in the Bhutan's national blood level lead level survey, which we'll be talking about today in this webinar. We also have Dr. Mahbubur Rahman. He's the head and associate scientist of the Environmental Health and Wash Research Group at ICDDR in Dhaka, Bangladesh. And he's a physician and public health expert with over 20 years of experience and leads research on environmental health issues such as water sanitation, heavy metal contamination, air pollution. So with this, I welcome all the panelists, and I'm really excited to hear your thoughts and insights. Before we go to the open forum or the panelists, Neha, we'll have the open forum later. We'll go to the poll. So we have a poll. Neha, I request you to launch the poll, please. So we have a poll. We want to understand from you, the participants, your thoughts and insights on the topic. So you'll see a poll. Um, there are 3 questions in the poll. So we quickly request you to, go through the poll and answer, and then we'll share the results of the poll. I see we've started getting in the responses. So we'll wait for another maybe 20 seconds more. Great. I think around 60% of the participants have responded to the poll. So Neha, whenever you are ready, we can maybe show the results from the poll. Yeah. So I hope the screen is visible and you can see the results on your screen. How aware are you about lead poisoning? And quite a few of the participants are aware, and some 5% have said not aware or slightly aware, 28%. So I hope this webinar now brings in a greater understanding and in-depth understanding of the critical issue at hand. Globally, how many children are affected by lead poisoning? A lot of you have said, I don't know, maybe 1 in 10, 1 in 3. Yes, 1 in 3 is I think the correct answer here. So around 40%, 47% of you have got it right. Great. We intend to talk more about this. Do you think lead poisoning is something that ARNEC members should be more concerned about? And yes, a majority of you, 92% of you have said yes, and that is why we have this interesting webinar for all of you. So we can stop sharing the results. Thank you so much, Neha, for that. And we'll now go to our presentations. So Evelyn, over to you.
Thank you, Neelima. And Neha, can you put up the slides, please? Yeah, so good afternoon, everyone, and thank you for joining this webinar as we try to increase, awareness on the impact of lead exposure on young children, on the health and well-being of young children. This webinar is part of ARNEC's advocacy on the need to address the impact of climate change and other environmental health threats, such as lead, on early childhood development. For this afternoon, though, I would like to begin by just sharing with you a bit of our advocacy on ECD and climate change. Children, as you know, are the least responsible for climate change, and yet they are the most vulnerable. For example, it is estimated that nearly 2.2 billion children will be exposed to frequent heat waves by 2050. Excessive heat, as we are now experiencing in this region, is known to affect, children more as their bodies are still developing and therefore more vulnerable to environmental changes. So in this slide, you will see that according to the Intergovernmental Panel on Climate Change, it is widespread, rapid, and intensifying. And UNICEF said that about 1 billion children, or nearly half of the world's children, live in extremely high-risk countries and suffer from the impacts of climate change. And these impacts, include, but not limited to, massive flooding, food shortages, droughts, heat waves, wildfires, and rising sea water levels, particularly in the Pacific islands, which is part of this region. Next, please. The impact of climate change, however, is not even. It has an overarching impact on families and young children. The WHO says that nearly 90% of the global health burden related to climate change is borne by children under 5. But the impact, as you can see in this slide, goes beyond health, and it cuts across the other components of nurturing care. Extreme weather conditions that lead to massive flooding, heat waves, and rising sea levels, for example, have devastating impact on children's health, learning, safety, and security, as well, to their on their mental health as well. And so climate, shocks, are also associated with economic hardships for parents and caregivers, and lead to an increased, migration and displacement for families. Again, a situation that is very evident in this region. Next, please. The Asia is at the forefront of the battle against climate change, as evidenced by data included in the IPCC report. The statistics in this slide confirms that Asia Pacific, region is particularly vulnerable to the impacts of climate change. Just for example, the ADB Economic Outlook Report of 2023 indicates that 24% of GDP loss is expected overall, in the region by 2100, and this is due to climate change, and concentrated in lowest income countries. The rest of the data in this slide confirms how our region is vulnerable to flooding, rising sea levels, and heat waves. Next, please. In ARNEC, then, we strongly, can you go back to the previous slide? One more, Niha. In ARNEC, we strongly believe that while young children are the most vulnerable to the impacts of climate change, we also have the tools and resources to address these challenges, through comprehensive ECD policies and programs. Investment on ECD, as we already know, brings the highest returns on human potential and well-being. It is key to reducing vulnerability, to building resilience, and increasing adaptive capacities, to combat climate change and other environmental health issues. When done mindfully, resilience building in early childhood can boost the implementation of the sustainable development goals, and enhancing, efforts to mitigate the impacts of climate change. We also have the global frameworks, available to build climate resilience. Some of these frameworks include the Paris Climate Agreement and the Sendai Framework for Disaster Risk Reduction. Next, please. And so, in partnership with Save the Children and UNICEF, UNESCO, foundations such as Bernard Van Leer Foundation and Bainum Family Foundation, ARNEC has been advocating for the intersection, of ECD and climate change, and has developed various resources to increase awareness and build capacity on this issue. Next, please. One of the key resources that we produced in 2022 is the scoping study on ECD and climate change. We published this in partnership with the University of Wollongong in Australia. This scoping study has 4 key recommendations related to policies, related to the need to have child-centered climate financing, highlight the voices of young children and the need to act at multiple levels, at the level of families, schools, communities, programs, policies, and financing. Next, please. Building on this scoping study, we have articulated what we call the ECD Climate Framework for Action that focuses on four action pillars: advocacy, generating evidence, building and strengthening capacity of the countries, and building partnership and collaborations, with members and partners from the regional, country, and global levels as well. If we can go to the next slide, please. We have been working with with Vital Strategies on an ECD and climate change toolkit. A toolkit that includes fact sheets on different climate hazards relevant to the region, such as air pollution, flooding, heat waves, and lead poisoning, as we are going to launch today. This climate toolkit aims to build awareness and mobilize actions, and especially at the country level. Next, please. We have also supported small studies in partnership with the countries to generate local evidence on how climate change is affecting young children in their respective contexts. To date, studies have been done in India, Pakistan, the Philippines, Bhutan, Indonesia, and Bangladesh. All of these are available in our website. Next, please. Another initiative is the ECD and Climate Change Knowledge Hub, which we have started to build, aimed at providing a platform, a space for consolidating ECD and climate resources, not just from ARNEC, but from partners as well. And we will soon be launching this Knowledge Hub. Next, please. A strong focus of our advocacy is on building the capacity of key stakeholders to understand and act on climate impacts as this affect young children. We have delivered ECD and climate change workshops in Indonesia, Bhutan, and Bangladesh. These workshops bring together various ECD and climate stakeholders in one room to discuss climate issues as this affect young children and come up, with an action plan for an advocacy campaign. So we continue to build regional capacity through these workshops. Next, please. We have also started to work with youth advocates in building their understanding on how climate change is affecting young children and how they can be strong advocates and champions for ECD in the context of climate change. This empowers youth to be champions for change, but also, create an intergenerational understanding of the impacts of climate change on young children. The voices of young children and their caregivers are often overlooked in the discussion, in the climate discourse. And through this youth-led initiative, we hope that the youth advocates will be champions, for ECD in the context of climate change. Next, please. Last, but not the least, is our effort to better understand the intersection of ECD, climate change, and emergencies. We are undertaking a small project focusing on building, regional capacity for emergency preparedness and response that is centered on young children. This includes a case study on the impact of the massive flooding in Pakistan that happened in 2022. Also mapping of existing resources and guidelines in the region that will feed into a regional training workshop to be held in the upcoming ARNEC conference in Manila. So in a nutshell, this is our advocacy on ECD and climate change. Thank you everyone for listening, and over to you, Neelima.
Thank you, Evelyn, for setting the context and sharing our next, initiatives and advocacy on ECD and climate change. Do check out our website for further details. Now, I invite Lynn Tang to kindly share her presentation on the health impacts of lead poisoning on pregnant women and young children. Over to you, Lynn.
Thanks, Neelima. And thanks, Evelyn, for that wonderful presentation. As Evelyn mentioned, today is also the unofficial day that we're launching the fact sheet on ECD and lead poisoning. And Neha, perhaps you can put a link in the chat for participants to be able to download the fact sheet. So a lot of the content that I'll be going through is actually from the fact sheet. I'm really glad that ARNEC and ECD advocates like yourselves are paying attention to lead exposure, because children under 5 are actually at the greatest risk of permanent damage and even death. And children under 2 in particular, in the first 1,000 days of life, are very vulnerable because they absorb 4 to 5 times more lead than adults, and they have hand-to-mouth behavior, object-to-mouth behavior, so they're more likely to ingest lead from their environment. Our region is also one that is highly exposed to lead. In our region alone, we estimate that there are 450 million children who are exposed. Lead is also currently widely used in many industrial practices and consumer products. So this map shows the blood lead levels by country, and the countries with the darker pink are those affected by lead pollution. And you can see in South Asia and Southeast Asia, it is a region of concern. So what are the impacts of lead poisoning on children? Simply said, lead poisoning affects the brain development of a child. So it can lead to lower IQ, behavioral issues, developmental delays, as well as heart, kidney, other kinds of organ failure that will lead to long-term health problems well into adulthood. This chart, which is also available in our fact sheet, shows the various symptoms that can arise from lead poisoning. And I think the key thing to note here is that these symptoms present themselves differently in different children. So lead exposure, lead poisoning affects children differently. For example, you might have one child who's experiencing the loss of appetite and weight loss, and another child that has headaches and developmental delay. And the fact is both of them could be affected by lead poisoning. Lead exposure is also cumulative and builds over time, so the onset of symptoms can happen very gradually. Frankly, there's no way to tell if a child is poisoned by lead just from their symptoms alone. As you can imagine, many of these symptoms are linked to many other ailments. And the only way to know if a child is poisoned by lead is through a blood test. In terms of pregnancy, lead in the blood of pregnant women has been shown to cause bleeding, miscarriage, stillbirth, premature birth, and other birth defects. And the World Bank actually analyzed the loss of IQ from lead poisoning and equivalated that to a 1.4 trillion loss in terms of future income due to the loss of IQ. And you can see that in our region, we account for almost 50% of the worldwide IQ loss, or 367 million IQ points. So this study took things a step further and looked at country by country. If they were able to eliminate lead exposure, what would the learning outcomes look like? And basically, they found that if lead exposure was reduced between rich countries and low middle income countries, it will account for 21% of the learning gap. And if you look at the chart on the right, you can see that lead interventions actually surpass some of the education interventions and will lead to better learning outcomes. So this goes to show that educational outcomes are really affected by lead exposure. So why are young children at increased risk? So again, I mentioned that they have higher absorption rates. Children in general also breathe, drink, and eat more per unit of body weight than adults. They have hand and object-to-mouth behavior. So, if soil or objects or toys have any lead on them, they're more likely to directly ingest them. Infants and toddlers who are crawling also have a higher risk of ingesting lead-contaminated soil. And of course, their brains and bodies are in a rapid state of development in the first 1,000 days. And any impact of lead exposure in the early days leads to lasting neurological damage. Unfortunately, the impact of lead poisoning, the health impacts are not reversible. So frankly, lead poisoning is not a new subject. There's been a lot of robust evidence and research on lead exposure, and it has been well known, for many decades. In fact, up to a couple of 100 years ago, people were already suspecting that lead leads to negative health impacts. So why is it still so pervasive, and why do we still have so many instances of lead poisoning? Well, one of the reasons is because lead has many desirable qualities that make it useful for a wide range of users. And one of these most common uses is in lead acid batteries for motor vehicles. So the increasing reliance of motor vehicles is fueling the demand for lead. And actually between 2000 and 2018, the number of new vehicles sold in low and middle income countries has more than tripled. And most of the global lead consumption is for the manufacture of lead acid batteries for motor vehicles. So what is wrong with lead acid batteries, you may ask? I mean, it does serve a function. And I think the best way for me to let you understand more about this issue is to show you this video from Pure Earth. The actual video is about 3 minutes long, but I'm just going to show you the first minute of it. And I think from there, you would have a very good understanding of the dangers around lead acid batteries. Just give me a minute while I toggle the video.
The process looks like this typically. It's done in a backyard. They'll take a battery, they'll take an axe to it, they'll chop the top, kind of rip open the top of the battery, they'll dump out the acid, typically just on the dirt, and then they'll remove the plates and essentially remelt them down in an open furnace. And the process releases lead dust. And lead dust is particularly dangerous to children, and it's particularly dangerous when it's done in residential communities where kids are playing all day, where pregnant mothers are. It is the #1 pollution source that we identify in the world. The informal recycling of these takes place in every city, in every low and middle income country, with very few exceptions. If you and I saw these batteries, we would call them all car batteries. In fact, they do not all go in cars. Anytime that they're
Hey, yeah, I know some of the images are hard to digest. And really, when we think about pollution and environmental and health impacts, it's always a difficult topic, but it's one that is a reality and one that it's good for us to be aware of these dangers. So in addition to lead acid batteries, of course, there are other sources of lead which me and the other panelists will cover later. Another reason why I think the use of lead has been very pervasive is because lead exposure and lead poisoning can happen quite invisibly. And many countries are not monitoring lead exposure among their children. And because they don't have data about the severity of the lead poisoning in their countries and what the major sources are, there's consequently very little action to regulate lead in many countries. In Asia, only the Philippines and Bhutan have recently initiated effort to monitor lead in children, and I'm very pleased that speakers from both these countries will be speaking later. So this infographic is also found in our fact sheet, and it kind of gives an overview of where lead can be found and how lead can be present in water, soil, air, and even in food. And perhaps food is one of the most pernicious sources of lead because you directly ingest it. So it really has a direct pathway into your blood and organs. And I've done some research on some of the consumables in our region that have been known to contain lead. and some of these are even directly fed to children. So when I first started working on lead poisoning several years ago, in my mind, lead is a metal, so I should be able to recognize it as something that's metallic, gray or silver. But the reality is that lead can kind of camouflage itself in many different colors. And some of the main colors I've listed here, white, bright yellow, bright red, and black. And actually, the many different colors of it is one of the main uses of lead. It's often used in paint. The yellow lead has also been added to turmeric. The black lead has been added to eyeliners. So it can be very deceptive because lead just doesn't appear as a metal. On this slide, I've just listed in kind of iconic bullet points what are the prevention strategies around lead poisoning. Despite how burdensome lead poisoning appears, there are actually many solutions out there, and many countries have successfully eliminated or reduced lead in their countries. So over here, I have 3 examples of countries that have reduced lead from known sources. In the interest of time, I'm not going to go through it in detail, but I do leave this slide here so you can visit it at a later stage. I want to close with bringing us back to the fact sheet that's being launched today. So in the fact sheet, we have a lot of information about why lead is harmful, why lead is pervasive, but we also have a very huge section on what we can do about lead poisoning, starting from the individual or family level to the institutional level to the subnational and national level. So I hope that you find this fact sheet useful, and I hope that we can collaborate more with ARNEC and its partners on lead poisoning prevention. Thank you.
Thank you, Lynn. Thank you for sharing, the details and the research and evidence related to lead poisoning. And there are some questions that are popping up in the chat box, and we'll take them soon. I'll now request Hassam. We'll proceed with the country experiences, sharing the country experiences. And in this regard, I would request Hassam from Pakistan to talk about the experiences of how lead poisoning is being tackled in Pakistan. Hassam, over to you.
Hi everyone, sorry, I'm just sharing my screen. I hope you can see the presentation.
Yes, Hassam, we can.
Great. So just a quick introduction to LEAP before we jump into the rest of the presentation. LEAP, or the Lead Exposure Elimination Project, is an international nonprofit. It's dedicated to eliminating childhood lead poisoning, and we are a member of the Global Alliance to Eliminate Lead Paint, a joint initiative by the United Nations Environment Programme and the World Health Organization to combat lead exposure in low and middle income countries. Our mission focuses on one major source of lead exposure, largely lead in paint. Lead paint is an important, widespread, and ultimately solvable source of lead exposure found in many contexts, such as in homes and schools, on toys and playground equipment, or from occupational exposure. Flakes of paint and contaminated dust are a highly concentrated source of exposure for young children, and even a very small amount of lead paint can cause irreversible damage to children. Moreover, lead paint regulation and enforcement are proven cost-effective ways to reduce exposure to lead paint. Switching to unleaded paints is also technically and economically viable for manufacturers, and these are activities we have supported successfully in a growing number of countries. To date, we have established programs in over 31 countries spanning Africa, Asia, and South America, where we've been supporting governments, manufacturers, and communities in their efforts to reduce lead exposure.
Now, the team's already spoken about the high-level lead impacts of lead on health in young children, so I won't go into more detail on that. I would like to expand perhaps a bit on why it's particularly devastating on children's developing nervous systems, because it has significant implications beyond just their health. Even at very low levels, it has been linked to cognitive deficits and lower IQ scores, as Lynn was explaining. But to give you an example, children with blood lead levels as low as 5 micrograms per deciliter score 3 to 5 points lower on intelligence tests compared to their peers. These effects are often irreversible. And while there are treatments for severe lead poisoning, they have not been effective in improving intelligence in children with moderate yet widespread exposure levels, which is the case for a vast majority of children. The broader implications of this are staggering. If you see the graph on this slide, if there is even just a population-wide loss of just 5 IQ points, this can lead to a 57% increase in the proportion of people who are classified with having intellectual disabilities, while having the percentage of individuals with exceptional intelligence. This not only strains resources for special education and remedial programs, but also diminishes the talent pool for future leadership, directly impacting a country's development and progress. Additionally, lead exposure can have profound effects on behavior and societal outcomes. The neurological damage it causes among children impairs executive functioning, reduces impulse control, decision-making ability, and self-regulation, while increasing aggression. There is in fact likely a causal relationship between lead exposure and criminal behavior. If you look at this graph from the 20th century, so just for some context, during the 20th century, leaded gasoline was a major source of lead exposure before it was phased out globally. And in the graph on the slide, you can see how the blue line represents the addition of lead in gas coincides with the brown one, which indicates the crime rate. Now, both graphs are 23 years apart, suggesting that being exposed to lead as a child could have led to violent and criminal behavior as adults, so around the 23-year mark. These findings highlight how lead exposure not only harms health, but also influences behavior and undermines social stability, making its elimination essential. Just to emphasize quickly as well on the economic impacts, Lynn already shared that over $1 trillion of annual losses to the economy of low and middle income countries because of lead poisoning. And to put that into perspective, that means somewhere around 6% of loss in GDP in many countries. And in countries like Pakistan, that is up to 9% in GDP losses. I will maybe shift now from talking to the health perspective to the sources of lead exposure and why LEAP focuses on paint. Now, lead exposure, as Lynn has mentioned, comes from various sources, included lead-based paints, the recycling of lead-acid batteries, water pipes and fixtures, cosmetics, contaminated industrial sites, e-waste, spices, and certain metallic cookware. At LEAP, we largely focus on one major source of lead contamination, i.e. lead in paint. This focus is driven by a couple of reasons. Firstly, lead in paint has been shown to significantly elevate blood lead levels at a population scale, and there is a variety of population scale evidence available for this. Secondly, LEAP has developed and tested a rigorous, proven playbook for addressing this issue, one we are confident in implementing effectively. And thirdly, lead paint is unregulated and available to purchase in many low and middle income countries. And I'll show you some data on this later. Lead paint is currently unregulated in over 71 countries. And as you can see, regulation largely coincides with the availability to buy in many countries. So lead is still available to buy in many countries, particularly low and middle income countries. And again, you can see in our region of the world, specifically what we're focusing on today, oil-based paints with lead levels greater than 90 ppm, which is what makes it dangerous for humans, is largely popular in our region. Now, I'd like to speak to what LEAP's model is. Our approach involves 3 pillars of action. The first one is conducting paint studies. This is to generate country or region-specific data on the status of lead in paints. The process consists of, firstly, testing lead in paints in the market to understand whether lead is added to the paint available in the public market. And secondly, using this data to understand the production and supply chains to map concentrated pockets of manufacturing, supply, and consumption of lead paints. Identifying geographies and manufacturers with significant production of lead paint helps us to prioritize and target interventions cost effectively. The second pillar is regulation enforcement. As you have just seen in the graph before, close to 71 countries do not have laws regulating lead in paints. And regulating lead in paints is in fact effective in bringing down the usage of lead in paints. LEAP therefore supports and works with countries to bring laws regulating lead in paints. In countries like Pakistan and India, where regulations are already in place, we also collaborate with these enforcement agencies to strengthen compliance and ensure the effective implementation of these regulations. The third pillar is industry outreach. We believe this is important because, as you have seen, even in countries where there is regulation on lead in paints, there is still lead in paint in the market. And this is why it is so important to provide free technical assistance and support to paint manufacturers to switch to lead-free. We currently have an in-house paint technologist who has worked in over 45 countries helping manufacturers to transition to lead-free pigments. We work with distributors and suppliers to provide reformulation support, connecting manufacturers to raw material suppliers. LEAP also funds the testing of reformulated paint products to ensure manufacturer satisfaction and consumer safety. This model of support has led to successful reformulation in several of our country programs, where we have seen small and large companies making the transition to lead-free. Now, unfortunately, I'm not able to speak more in detail and give you tangible results for our work in Pakistan because we are currently in the process of approving the sharing of this data with our government partner. But I will now share a case study of a country where we have seen similar progress to what we have achieved in Pakistan. And that country is Malawi.
Hassam, sorry to interrupt. If you could just, we're running a little over time, so can quickly. Thank you so much.
Sure thing. So I will just quickly inform you that in Malawi, we started working in 2020. We conducted a paint study there, and now we have conducted a follow-up paint study for which I will share you the results with you. Now in Malawi, the proportion of leaded paints in the market because of LEAP's intervention has decreased from 67% to 24%, a significant 64% reduction in the amount of lead available in the market. Our modeling estimates that by 2021, this means that 215,000 children will no longer be exposed to leaded paints, and that this reduction in exposure translates to an estimated $185 million in lifetime earnings that would have otherwise been lost. Our efforts are following similar impactful trajectories in larger countries such as Nigeria, India, and Pakistan. All 3 countries already have a mandatory standard in place, and LEAP is now working directly with large manufacturers to support reformulation and is starting to provide technical support to the government to bolster conformity assessment and enforcement of the standard. I'll now pause there and leave to the rest of the panelists to present their findings, and I'll take any questions that you might have at the end of the call.
Thank you, Hassam. Thank you for sharing those important information. And I'm sure there'll be questions which we can refer to you. Okay, moving to our next country presentation from Philippines, Lara.
Hello, everyone. Really meaningful presentations that we had already. So let me just go straight to the topic that was given to me. I'll be sharing on the efforts to institutionalize BLL screening or blood lead level screening and follow-up services in the Philippines. I'm Larah Ibañez. I'm the country director of Pure Earth in the Philippines. So Pure Earth is an international nonprofit organization, and we are focused on having this vision come to reality, a world where all, especially children, are able to live healthy lives and reach their full potential, free from exposure to toxic pollution, which is very real in countries such as ours. How we do it is that we collaborate with the government, with CSOs, with the academe, with practically all stakeholders to prioritize actions that are backed by sound data and have the most potential to render the measurable impacts as shared already in the earlier presentations. And we are also part of the Partnership for Lead-Free Futures and have been a great advocate and contributor to the reports cited earlier, the Toxic Truth Report, the Lancet, and also the Protecting Every Child's Potential initiative way back. If you go to Pure Earth website, you will see that our global lead program highlights this 5-step approach, which is 1, health surveillance. We do blood lead level screening to generate data on the levels of exposure when it comes to children, particularly, including also pregnant women. And then we do source assessments, particularly before we went into environmental health, we were really having this program on toxic sites identification program where we do test sites for lead levels. This includes legacy sites. Some of them are active sites, and that's where we encountered what Lynn mentioned on the used lead acid battery recycling industry in terms of like formal and informal livelihoods. And then recently, we backed this with rapid market screening, which I will share more on later, where we test products available in our public markets for lead levels. And we did find out those consumer products. And then we followed up with home-based assessments where we tried to see if those products in the markets are ending up in the homes and thus sources of exposure for the families right in their homes. And the reason behind health surveillance or generating blood level data and then source assessments or generating data on blood levels, whether it's in the environment or in consumer products, in the market and in the home, is to have to identify the topmost sources of exposure so that we can develop source-specific interventions. I know that ARNEC members and all the rest from the development world will be able to relate that in this kind of work, we have limited resources and also timelines. And so we have to be specific as to interventions. And then we back this up ultimately for sustainability with institutional strengthening, and that is not just awareness raising, but more trainings and capacitation in terms of personnel, equipment, and systems, so that even after project life, these initiatives can continue. And communications, so that we can keep on raising advocates from all sectors pushing for this kind of work. Just to share from the Philippines, the blood lead level data that we know as of date. So here you can see that in previous studies, there are already levels of blood lead levels determined, but these are focused on targeted sites, which are known to have known sources of exposures to lead. And the range was 4.5 to 50 micrograms per deciliter. And then recently, we had an opportunity with our National Nutrition Survey through the Food and Nutrition Research Institute of the Philippines, with around 3,000 children with a limited age group, 6 to 9, from 13 regions, or over 300 cities and towns in the Philippines, and the average was 1.96. In terms of range, it was lower in a sense because the range was 1.4 at the lowest, the orange line here, to 38 micrograms per deciliter. However, it must be emphasized that there is no safe level for lead, and there remains a need for regular monitoring, because if you compare that to the action level set by the WHO, which is 5 micrograms per deciliter, or the US CDC, which is 3.5 micrograms per deciliter, there remains that vulnerability because of lead exposures. So there is a limited in scope available data, but it's better because it gives us an idea of what's existing before and what we have right now. And it's lower than previously thought, but we remain vulnerable. And it's most likely site-specific, but still we need a country baseline and to identify those hotspots. In terms of estimation on the percentage of children's population at risk, for the IHME estimate using the previous studies, they estimated that 50% of our children's population are lead poisoned. But using the 2021-2022 ENNS data, we estimate that it's less than 10%, 8-point-something% of the population ages 6 to 9 are exposed. If we turn that into actual numbers, before you would estimate that around 20 million children under 18, but if you again use the 2021-2022 ENNS data, we only have limitation for 5 to 9-year-olds, and that will be 1 million children at risk of lead poisoning. In terms of lead levels in toxic sites data, well, we have in 2012 our toxic sites identification program, and 50 or so of those sites have lead as their main pollutant. And then in 2016, we had an opportunity again to work with the government to survey lead handling establishments in the country, and that's close to 300 establishments. Now, the main gap here is not only that the average reading was around 57,000 parts per million, which if you will compare to the, again, US EPA standard for play or residential areas, which is 200, or even industrial areas, which is like 1,200 parts per million, this average level is 47 times or 285 to 285 times over the set standards. Even more than the levels found out is this gap on having no recent environmental assessments. The data may be available, but limited to registered industries, and the question on who should carry the assessment going forward. So there remains a need for that. And then just quickly, I will point you to a global data on based on our rapid marketplace screening involving 25 countries all over the world. And you can see here the link where you can access the whole report. But to give you a snapshot of the results, you can see the box size will pertain to the number of some samples gathered from all the 25 countries, but the color coding will lead you to the more red it is, then the higher the percentage of those types of products exceeding the standards for lead in those in that category. So you can see here metallic cookware, paint, ceramic foodware exceeding the standards, like 41% to 51% of the samples exceeding the standards for lead. And of course, cosmetics, toys, spices also contribute to that. You can see on the other hand, in terms of like our region, East Asia and Pacific, South Asia, it is still ceramic foodware and metallic foodware and paints as well. For the Philippines, for instance, we do have regulations on like the chemical control order for lead, but we found out that even with that regulation, there has to be a need of monitoring whether there is compliance in terms of the paints available in the markets and also the paints used already in the old homes and what do we have to do with them. Quickly, just to give you a snapshot of the progress in the Philippines, to give everyone a quick view of how to progress. We have to gather data. That's what we have been emphasizing. So we had a blood lead level survey in 2021 to 2022. We shared the results to the stakeholders the following year. And then by 2023, it was included already in our National Environmental Health Action Plan. And in 2024, last year, we had our first blood lead level screening initiated by a city government. And this year, there was this joint declaration by the government agencies and stakeholders to take out lead. I see Neelima, so I'm conscious about the time. So I'm gonna click this quickly here. Our encouragement in highlighting Valenzuela is that it is possible for, say, if you're waiting for a national government to really institutionalize this kind of program or policy, we can start with a city level to put in the policies and jumpstart type testing and then the follow-up services. And it is a growing potential that Valenzuela is presenting. We can share you the link to the video presenting the updates in that particular community. Let me just end here. Just give me a minute or two here to highlight the synergies needed to stop toxic lead exposures and protect children's futures. Of course, it is very overwhelming if you think about the problem, if you think about the impact on the children, and it takes a lot of actors to really come up with a solution. So I highlighted ECCD here and the DepEd in our context because from the advocates on the early childhood care and development sector, there can be a push for blood lead level screening of students, especially children 0 to 5, and a promotion of healthy settings where your classrooms, your playgrounds, your toys or materials or art materials in their facilities are free from lead. And it can be also included in the curriculum so that children are aware and their families are aware and they can protect themselves at the very least while we're waiting for institutionalization. So hopefully in the next 3 to 5 years, we'll have more scalable, impactful models. We'll have national case management guidelines. It will be integrated in our universal healthcare package, and that blood lead level screening as a service will be made available, accessible, and affordable, because early detection is early intervention and the children deserves their futures. We have to act together to protect their future potential. Thank you very much.
Thank you, Larah. Thank you so much. And I really hate doing this, but in interest of time and so that all presentations are done. So I am sorry about that. But thank you for presenting a very solution-based approach also. And we have shared the link for the video in the chat box. Do check it out. Moving to our next presentation from Bhutan, I would request Kinley to kindly talk about the National Blood Lead Level Survey in Bhutan and what were the findings and the way forward.
Thank you so much for this opportunity. Is my screen visible?
Yes, Kinley, please go ahead.
Thank you so much for this opportunity now. So as the earlier speakers have already mentioned, now if you look at the issue of blood lead levels and then also the impact of blood lead level, it's enormous, and I need not further explain on what are the impacts of this lead poisoning. But if you look at the Bhutan's case, the issue of lead poisoning in Bhutan actually was first the issue was first recognized or popped up when a team of researchers led by Dr. Philip, who also works for International Partnership for the Sustainable Development, the Sustainable Health and Development, and also a volunteer in the Gesar-Gelpo University of Medical Sciences in Bhutan. And his team did a study in the 2 districts, they looked at the blood lead levels in this the children aged 1 to 6 in these two districts and found alarmingly high prevalence of elevated blood lead levels. And subsequently, another researcher, Mr. Kipem, and her team also looked at the sources of the lead levels in different items in and around the ECCDs, the schools, health facilities, and playgrounds where children usually go. So they also found that the sources were widespread, and it's in across all the items, including the soil, the furniture, the paints on the furnitures, and even the public grounds. So recognizing this, the Bhutan then took the step to actually assess the prevalence of elevated blood lead level in children, as well as looking at the sources for blood exposure to lead level in children aged 1 to 6 years. We also looked at the pregnant and breastfeeding women and children in monastic communities. So now it was during from this survey, we have found that the children with blood lead level above 3.5 microgram per deciliter was alarmingly high, with almost 3 in 4 children or 75% of the children having blood lead level above 3.5 microgram per deciliter, and more than 50% of the children having blood lead levels above 5 microgram per deciliter. The issue is not just in children, but elderly population, the pregnant and breastfeeding women are also having high elevated blood lead levels. So if you look at this 3.5, 3 out of 5 pregnant women or breastfeeding women had blood lead level above 3.5 microgram per deciliter. And we also looked at the blood lead levels in the monastic children aged less than 13 years old, and found that 86% of them actually had blood lead levels greater than 3.5 microgram per deciliter. Now, recognizing this issue as a widespread and alarmingly high prevalence of elevated blood lead level in the children, we actually need to now look at the sources, and then in order to tackle this issue. So we looked at the sources in 67 households, the 4 ECCDs, and even the schools. And we looked at the traditional items, the household and kitchen items, spices, cosmetics, toys, the school items touched and played by children, soil, plant, which are actually globally established sources of lead exposure. Apart from that, we also looked at country-specific sources, because as mentioned by the earlier presenters as well, when you look at the sources, there are different, it's a multicultural area where we have lots of different items. The country-specific sources could be there. So we actually looked at these sources as well. Now, from the consumables, if you look at this, Jinlab, special peel, blessed peel, which is usually produced after all these spiritual and religious rituals being performed and cleans, and then it's given as a blessed pill to cure illness or cleanse yourself. So in that, we have found that 44.2% of them actually had lead levels above threshold. And in the spices, 20% of the spices that we have actually tested had the lead levels above the threshold. So when we look at the sources, it's widespread and contains in varying amounts from less than 3 to 3, the non-detectable lead to almost as high as 7 to 8% lead. And then if you look at the consumables, 42% actually, around 42% of the consumables actually had lead in them. Of the consumables, as I mentioned earlier, Jinlab has around 44%, and 22%, 20% of the spices actually had lead beyond threshold. from the non-consumables also 9% of the toys, then around 9.8% of the school items being played or touched by children, around 3.5% of the soil around house and playground were also found to have lead above threshold. In contrast to many of the studies, we have found that only 0.8% of the paint actually the paints on the wall, interior wall and exterior walls, and then also paint on the equipments or items found in the playground actually had lead in them. So these are the detailed findings from the current sources survey. If you look at the spices, we have looked at chili powder, cumin or jeera, then turmeric, masala, spices. However, I must say that we have not segregated this on whether it's an imported brand, locally produced, or the source of that spices are not traced. So it could be either locally produced or imported as well. When it comes to the cosmetics, we have tested very few number due to less number of use of cosmetics here. So we actually tested only 14 and then found that the maximum ppm of lead in this was found to be 25. We also tested the kitchen items, starting from drinking cups to the traditional handmade spoons and ladders to traditional handmade pots and other eating utensils as well. So here also 11.5% of, 21% of the kitchen items actually had lead above reference thresholds. As shared earlier, we actually looked at the items which are unique to Bhutan, such as the religious and traditional Bhutanese items. And however, there is no set threshold for all these items because we have not done the leaching test and all this, how much of this lead can actually be coming off and enter the human system. But if you look at this, 75% of this religious and traditional Bhutanese items actually had lead in them. So now, while we have looked at the general sources, we also have looked at the item-specific sources. So as shared earlier, Jinlap had actually 44.2% of the Jinlaps that, the religious peels or blessed peels that we actually tested had lead in them. And from there, we looked at the main ingredients, the sources, where they come from, and then checked the lead in them. And we have found that it was around 400 ppm. So when we traced back, there was one particular ingredient being used for this item, and which was 99.9% lead. So when we removed that item, the religious blessed peels actually had lead of 0.6 ppm to only 7.67 ppm. So all in all, I think we need to now take a multi-sectoral approach. Bhutan having a very strong political and government support in tackling these issues, starting from the highest level, and Prime Minister himself shared that we must now expedite the interventions to address this issue. So we are actually taking the multi-sectoral approach, where we need to now go as a whole of a government and whole of a society approach in order to tackle all these issues. Thank you so much, and Tashita.
Thank you so much, Kinley, for sharing a very unique perspective from Bhutan, and how traditional items and religious items can also contribute to this lead poisoning. And also very impressive, that the interventions and solutions are coming from the highest authority. So that's really required and needed. Thank you so much for sharing that. Okay, to our last presentation, but not the least, from Bangladesh, Dr. Mahbubur Rahman, over to you, please.
Thank you so much, Neelima. Let me share the slide quickly. I think my slide is visible, right?
Yes.
Okay, thank you so much. So ICDDR is an international research organization located in Dhaka, Bangladesh, and solving the public health problem since 1960s. So let me talk about, there are many toxins in the environment and lead is particularly bad. Lead is a metal, it's a toxin, and we cannot always see it where it is there. So it's making our life difficult, whether this is in the food or in the supply chain or in the utensil, wherever it is, it's really difficult to trace them. So how does lead affect our body? We have heard already many of these things. I will be very brief. Lead affect directly to the heart as well as to the cardiovascular system. You already know that it has impact on blood pressure. It also disrupts the endocrine systems. It also affect the like pregnant women as well as to the developing children in the utero, and it has impact to the nervous system. So we already knew about that the impact of lead affect the brain. It affects the brain of the mother, affects the brain of the developing children. Higher the BLL, different studies and evidence shows lower the IQs. So lead directly affect the brain as well as the intelligence, and in fact, people are exposed to the lead like they have more impact on this, especially the cognitive deficiencies in thinking, deficiencies in intelligence, and which are irreversible. If I tell you the major sources in Bangladesh, it's similar to these Asian countries also, lead acid battery recyclings. This is one of the sources. Adulterated spices is another sources. Cookware is another sources, but still a lot to explore about this. Plastic toys, there are ceramic pots as well as leaded paint. Let me go back to in 2012. So ICDDRB in collaboration with Stanford University, we did a large trial. From that subset, we tested the pregnant woman blood in rural Bangladesh. The study was one of the outcome was to see the impact of child growth and development. So we were interested to see that whether where we are with this pregnant woman in the rural Bangladesh and their blood lead level. And surprisingly, we found that more than 31% of the pregnant women had high blood lead level. At the time, it was like a reference value was 5 microgram per deciliter. We were really surprised how this rural pregnant women, they get lead in their blood because there is less gasoline, lead is phased out from the gasoline. There are very few industries in the rural Bangladesh along with other scope of exposures. So what we did after having the high blood lead level to this pregnant woman, we tested, there are many environmental samples like, for example, water, then like soil, utensils they have been using, food, and other items used in their regular life. And we found that out of all these tested samples, these 3 showed items I had high blood lead level. I am not talking about the others too, but especially turmeric that we use in our subcontinent on a regularly in every day in our curry. So we were really surprised how this turmeric get contaminated with lead. And this is the most prominent source. We thought that we need to further exploration on this. So what we did, we tested, because the turmeric grows all over the Bangladesh, as well as there are wholesale markets in different region in Bangladesh. So we tested samples from the different region. We talked with the agricultural department as well as farmers, wholesaler, retailers, everyone collected samples and tested. So we found that turmeric contaminated with lead, and like explored the sources, like how this turmeric is getting contaminated. And we found that there are different quality of turmeric, and to make it more brighter and yellowish, this business people, they have been using lead chromate, which make it more brighter. It's usually they use it like there are different different steps for processing of turmeric. Like when you have the raw turmeric, then they boil it, then like dry it, then polish it, and during the polishing process, they use this lead chromate to make it more brighter and yellowish. And this is really doing by the instruction from the wholesaler. It's not the people, those who are growing the turmeric, they are responsible for this, but these business people really contributing to this like contamination. And after that, when we found that is turmeric contaminated with lead, and how we came to know that this lead is coming to the turmeric. But even then, it was really difficult for us to establish whether the blood in lead in pregnant women blood is coming from turmeric or not. But to establish it, we did the isotopic analysis, because it can tell you the origin and source of the turmeric, source of the BLL, blood lead level. So that we found that the isotopic ratios in turmeric as well as in the lead in the pregnant woman blood, which matches, and it proved that the blood lead in pregnant woman blood is coming from the turmeric. So what we did, based on this evidence, we directly started working with the government of Bangladesh. We worked with the Bangladesh Food Safety Authority. We oriented them, we trained them, we shared with the evidence that we generated. Based on that, Bangladesh Food Safety Authority, they took action to reduce the contamination of lead from the turmeric. So what they did, they published this news to the all print and electronic medias. They did the awareness building activities in the wholesale market, business people. They did several stakeholders meetings in collaboration with ICDDR and other partners. And finally, what we found that based on this intervention, along with the government and print and electronic media, including the different segment of population, those who are engaged and contributed from the different ways, and which basically impacted a lot within a short period of time. You can see here that 47% to it come to below less than 1% in 2021. So which really helped to reduce the turmeric contamination with lead. So this was the story about the turmeric contamination and reduction of turmeric contamination from lead. I am just going quickly to share with some other evidence in Bangladesh that ICDDR and other colleagues, they did, that lead poisoning is significantly associated with stunting, and what we found in an urban study in Dhaka city. Here you can see the findings. Along with this, recently we did a study in Dhaka city, representative samples from the Dhaka City Corporation. We found that 100% of the children, they had the detectable lead in their blood. 80% of the studied children, they had the high blood lead level as per the reference value. And one important thing for the lead study, even if you know that the high blood lead level, it is important to find out the exposure pathways, because if you don't know the exposure pathways, it will be difficult to design the intervention and reduce the lead exposure. What we did for the turmeric, similar to these others, and we found that in Dhaka city, children living within the 2 kilometers of lead-related industry had higher blood lead level. Similarly, for with the pure earth, we did a study in the like Mirzapur, Bangladesh. Like we measured the beer. It is a abundant lead basari recycling site, and we did the baseline and found that the high blood lead level of the children living in that area. At the same time, pure earth did the interventions like soil remediation interventions. And then after 1 year, again, we measured the blood lead level. We found the significant reduction of blood lead level of the children. But even then, important message is here, it does not come down below the reference value. And one of the reason could be, you may aware that if you have a chronic exposure to lead, it deposit to the to the bone, and if it is deposit to the bone, it's really difficult to reduce this exposure in a time period. And finally, I'm going to tell this is emerging issues about the cookware. We did not explore much, but many cookware in the markets, we found that high blood lead level, and still many countries we have been doing the leaching test, whether and how much it leached and whether it is impacting to increase the high blood lead level of the population using these cookwares. So addressing this disparity and limited investment, understanding the scale of lead exposure problem is crucial, but current investment is very limited. Non-profit is spent up to 10 million annually on lead exposure in developing countries, mostly relying on government funding. The put in the perspective effort to combat HIV/AIDS received 2.8 billion in government. You can compare the funding situation. And based on the recognition and the work that we did on turmeric, we have from the food safety, and globally there are some recognition for the colleagues here at ICDDR and Stanford. And thank you so much for all of your patient sharing. Thanks so much.
Thank you so much. Thank you. I think it was a really wonderful insight into the Bangladesh context and how you've been addressing this issue. So I would like to thank all our panelists for their valuable insights. And it's clear that there is no one method or one way of resolving this issue. It requires a multifaceted approach. It requires collaboration with communities, with parents, with governments, with education bodies, and a lot of research also on the way. So thank you so much. We wanted to open the forum for questions, but I see there are a lot of questions that have been posed and answered. We also have a lot of interaction on the chat. So this is not the end of it. We encourage you to stay connected with this critical cause, and whether it is through advocacy, whether it is through education, or supporting ARNEC's ongoing work. We'll also be posting a post webinar, sharing a post webinar board where you can stay connected with this issue. And also requesting Neha now to share the details about the ARNEC conference, the slide on that. So before I wrap up, I would like to share a few things about our upcoming conference. This is in Manila, Philippines, as Evelyn had mentioned. And the early bird registrations are on. So quickly, we encourage you to benefit from this early bird registration, and hope to see you in Manila. Next slide, please. We'll also, there's been a request, or in the chat box, there've been questions related to downloading the presentation. This presentation and the recording will be available on our ARNEC website. You may access it from there. And also, don't forget to follow us on X, Facebook, and LinkedIn. And the very important part, which is the evaluation. Please, it will take just a minute. We urge you to, scan the QR code. And Neha, if you can also share the link if there is one, and you can click on the link and complete the survey. It's just a 1-minute survey. It will help us to better plan our future webinars and our sessions. Thank you so much, everyone, for joining. And thank you, Neha. Thank you, Joel, ARNEC team, for bringing this together. And a very, very big gratitude to all our panelists and speakers. Thank you so much.